So thanks very much for that, Carl. I think Demetrius, you're going to lead us off with questions.
Hi, Carl. Thank you very much for this exciting data. I have two questions for you. What are your comments on the safety? We had 2%, almost 2% endophthalmitis, 2% RD about, 15% cataract, and 4% VTHIM.
Sure.
What are your thoughts on that? And the second question is, do you think that the refill criteria and the rescue criteria were not maybe quite as good and as they should have been? Because if they were good, since you allow for rescue and refill, all the arms have been the same vision gain. Yet we see that the vision gain in the low dose is actually loss of letters, and there is no good visual acuity overall, only about 2 letters or 3 letters, which is much less than other studies have shown with anti-VEGF. Your thoughts, please.
That's a very long question. Well, I'll answer safety first, and I'll answer cataract's easy. Cataract was essentially identical among the 3 PDS arms and monthly injections, coming in at 15 to 7%. It's actually 17% in the injection arm and about 15% in all the PDS arms. So it doesn't look like the device or the procedure accelerates cataract. Remember, a vitrectomy is not performed when the device is implanted. It's just popped in after the incision. So for probably the most concerning types of complications, that we're much less concerned about vitreous hemorrhage. Hemorrhage rates are way down now, and it's more of a nuisance, especially when they're minor, and most were. So for retinal detachment, infection, right now, into phase 3 in particular, there's greater attention on the surgical technique than conjunctival closure. Yes, one of those infections actually was associated with a conjunctival dehiscence, and so in study, the good news is that we have about an average of 5 additional months of follow-up, some patients out as far as 38 months, and we're not seeing any new infections or conjunctival issues. Not one new event had occurred over additional follow-up. What we really need is higher numbers, and we'll get that in phase 3, and longer-term follow-up, which we're going to get with the portal extension studies, that all patients that were in latter phase 2 and the phase 3 archway program are going to be followed for many years. And that's when we're really going to be able to get a better feel for the overall safety of the device. What was the last question?
About the refill criteria and the...
Oh, yeah, the refill criteria.
Because if they were strict, they should have had a better visual acuity, and you lost vision in the first 2 arms.
Sure. The lower doses did not perform as well visually. Actually, anatomically, they looked pretty comparable, though. So I can't tell you exactly why that was the case. More recent information seems to suggest that certain types of fluid actually can be fairly well tolerated, like subretinal fluid. Intraretinal fluid, less well tolerated. And so we don't have a breakdown of the fluids here. The refill criteria is actually not all that different from many other sort of sustained delivery platforms or even drugs in clinical trials, anti-VEGF drugs that are treated on an extended fashion, PRN fashion, so forth. So, there's some balancing act there between allowing some recurrence before triggering a premature retreatment, for example, or refill.
Thank you very much, Carl.